Today I would like to tell you a little bit more about our experience developing Neuron Sleep Mask. We started this project more than 2 years ago. We thought it took us about a year to bring the product into the market. We had a slight delay, but I would like to tell you why. I would like to tell you how the product looks like today. I have a product with me today, so after the presentation you could stop by and take a look. So a few words about our company. Our company is not only the Neuron. We like to say about ourselves that we are a hardware development house. We are developing new technologies. We are developing wearable technologies, sensors, and artificial intelligence around these technologies. And our goal is to bring medical devices and wearable devices together. So right now, if you take a look at the medical market, there are like huge, very sophisticated medical devices, but unfortunately, they are uncomfortable for the patients. They don't like to use them. They accept usage of these devices because they provide them a value. But it's not like they want to use these devices every day. They just want to step by, use this device, get diagnosed or get treated, and forget about it. So our goal is not to having this situation any longer. We want to combine utility of wearable devices with accuracy of medical devices. And so this is our big goal. With Neuron, we also trying to bring medical devices and wearable devices together. We are trying to bring accuracy and utility of the wearable devices. And the goal of Neuron is to monitor your sleep in the most accurate way possible, according to the latest medical standards, and to provide you some kind of action that you could change your sleep so that it will be suited more for yourself. So today I would like to tell you about a few factors about our device, about the reason why we get covered so well in the international media, why we pre-ordered so many devices. How many, I will tell you a little bit more by the end of this presentation. So I would like to tell you about current macro trends in wearable
Jeff
markets.
Barton, widziałeś postać?
Excuse me? Okay, sorry. So I would like to tell you more about the market trends at the current market, wearable market, Internet of View market. I would like to tell you about the micro trends in sleep wearable markets, that it's still growing. I would like to tell you about the customer pain, about the pain of people who cannot sleep well. There are more severe and very, very serious diseases, and it can destroy the whole life of the patient. And I would like to tell you more about bringing accuracy and utility of the medical device and wearable device together. And finally, about going global, how we went global with our device. So if we take a look at the latest report made by international consulting groups, we could see that in the upcoming years, wearable market will be growing, but wearable market connected with smart clothes. People in the near future will not use separate wearable devices because everything will be built in our current clothes, so we don't need to use anything apart from our clothes. So if we take a look at the highest graph at the screen, we could see that smart clothes market will be growing very, very fast. If we take a look at the graph below, we could see that professional medical devices markets will reach the highest point around 2018, and then will be slightly going down. The same situation will be with personalized devices that we are wearing on our wristbands, smart wearables. So the current trend is to build in everything together in the cloud that we have and that we are using right now. On the other hand, we have a smart sleep wearable market. And it's growing really fast as well. If we take a look at the recent Kickstarter campaigns, we could see devices that's been funded more than a few times last year, raising more than few $1 million. The most successful campaign was HelloSense. It was like a cube that measures sleep remotely, that you putting the device at your nightstand, and it's trying to measure how well you sleep by your movement. I will tell you later on how we are different and how different is our approach to the sleep measurement. So people at this market have different pains. There are different categories of sleeping problem. Basically, there are two big groups. The first one is circadian rhythm disorder. So your internal body clock is desynchronized with external body clock. So you cannot fall asleep at the right time. When you're waking up in the morning, you feel tired and so on. So it's all about synchronizing your biological clock with external clock of the earth. The second problem is sleep apnea. Is the most common sleep problem. During the sleep apnea, you basically cannot breathe. So you're feeling like lacking of the air, and it's very unhealthy for your organism. It affects different organs in your body just because you cannot breathe properly during the night. So the recent research shows that people around the world have very severe problem in sleeping. They cannot sleep well through the whole night. They're waking up in the middle of the night. They cannot fall asleep fast. And when they are waking up, they feel tired. So this is a really massive problem, especially in Western countries, in developed countries. One of the main reasons why people cannot fall asleep in the night, adult people, is that all of us using technology before falling asleep. And electronic devices used 1 hour prior falling asleep could be really harmful for our circadian rhythm, for our body clock, because they release artificial blue light that affects melatonin, that is a main sleep hormone in our body. So because of that, the sleep hormone is being delayed, and we cannot fall asleep in the moment that we would like to. Another big problem in the current market is a jet lag. So millions of people traveling around the world, going overseas, and people don't know about the jet lag, about the syndrome of jet lag, and how to treat the jet lag, how to get rid of jet lag. The research you can see at the screen right now tells about little research done on a flying crew in India. And among flying crew, only 40% of them knows about the jet lag. And but 90% of them feel the jet lag every day when they're flying around. The way they take care of jet lag currently is by taking drugs and using alcohol. So there is no possible solution currently at the market that would help us with a jet lag. So the way we bring utility and accuracy to the market is by providing our users a set of features. So we are providing our users sleep analytics. So we are measuring sleep using golden standard, which is brain monitoring, and providing our user with sleep staging. So we give you a feedback how your sleep looked like and also calculating sleep scores. So it's overall calculation, how good was your sleep last night. We're providing a jet lag therapy. We're using bright light therapy. This is a medical therapy. And using this therapy, we could delay or advance your body clock. So we could help you synchronize your internal body clock with external body clock of the Earth. And we also providing you adjustment of your body clock if you're not traveling anywhere. So you could have problem falling asleep if you're staying at home, for example, because you're using electronic devices. In this kind of situation, we're also providing you some kind of therapy that will help you fall asleep faster. So the device consists of a set of sensors. As I mentioned, we are measuring brain waves in order to stage your sleep. We're also measuring your heartbeat and also oxygen level in your blood. We are measuring how you're moving during the night and provide you a light therapy in order to affect your body clock, to synchronize your internal body clock with external body clock. So currently, there are a lot of devices that tracking your sleep, how well they tracking your sleep. You could see at the screen beside me. The highest graph is polysomnogram. This is a golden standard medical device. So if we are thinking about measuring sleep, we need to compare our device to the golden standard, which is a polysomnograph. So you could see a few devices currently available at the market, and their comparison to polysomnography. On the other hand, you could see our device and how our device looks like in comparison to polysomnograph. So as you could see, polysomnograph is the device that measures your sleep, but in order to do so, you need to connect your body to the set of wires. So it's really uncomfortable to sleep with. On the other hand, it's very accurate. However, you cannot connect yourself by your own to this device. You need a special technician to take you to the hospital or come to your house and connect you to this set of wire. Our goal is to simplify this method. So the only thing you need to do is put on your device. And at the screen below, you could see the current status of our algorithms and the comparison of our algorithms to the polysomnograph algorithms and how well they stage the sleep. At this screen, you could see the comparison of signal acquired by our dry electrodes and with wet electrodes of the medical device. So as you could see, sampling and quality of the signal is very high as well, not only the automatic algorithms. I would like to tell you a little bit more about the biology of our device, how it affects our organism. So it was research in the Stanford University, how the light therapy affects our organism. So the light sent from our device or any other device that provide a bright light therapy going through your closed eyelids affect your eye and send information to the part of your brain that is called suprachiasmatic nucleus. This part of your brain is responsible for synchronizing your body clock with the Earth body clock. And by affecting this part of your brain with the light, we could stimulate your body clock. We could move your body clock, delay it or advance it. So this is how we could help people with jet lag or help people fall asleep faster. So our technology, the technology that we use, the technology of pulsation light, was confirmed by the Stanford University last year. And at the graph at the right side of the screen, you could see comparison of placebo control and treatment group. So you could see the flash part of the screen moved the body clock, delayed the body clock in comparison to the dark placebo. At the screen in the upper corner, you could see it is called evoke potentials, and it means that this light going through your closed eyelids and affect your brain. This screen represents how your brain reacts to the certain stimuli. Currently, we are running clinical trials in the US. We expect the results probably in the next 2 months. We are examining shift workers and how our treatment affect their health, affect their body clock, and how well it could help them working on the night shift. We just came back from Cleveland, where we won the first prize in the best startup competition. So the jury of physicians said that our device is really, there's a huge potential in our device, both in circadian rhythm management and in sleep apnea detection. We are currently running some trials with various airlines around the world using this device to minimize the jet lag effect. We also expect the outcomes probably in the next 2 months. So one of our main strategy with this device was going global. We didn't want to be only among Polish market. From the very beginning, we were going to conferences outside our country. Finally, we started with a crowdfunding project in the US. We raised almost $500,000. We got the first investor, which was Hard Gamma Venture. It was pre-seed investment. So there is our company is very, very promising for the potential investors. There is huge funding opportunity, and because we went global with this company, we are also highly recognizable outside our country. So because of that, by the moment of market our device, we pre-sales more than 5,000 devices, and this month we plan to start shipping devices and start selling these devices. The nearest biggest conference we are going to attend is CES in Las Vegas, and hope it boosts our sales to the sky. Thank you very much. Do you have any questions? Okay.
At the start, everyone was about polyphase sleep. It was to decrease time that you need to fully rest. What was the main obstacle that made you drop that project?
So during the Kickstarter campaign, during the polyphasic sleep campaign, a lot of scientists contacted us from the US, from Stanford, from Henry Ford Hospital. So they said that this device could be really potential for the sleep medicine. It could be really potential for people having sleep problems. But we need to pivot a little bit our technology. The biggest problem with polyphasic sleep was that there was no biggest randomized double-blinded studies confirming the long-term results of using this technology. This was the biggest problem, and like we couldn't guarantee that, for example, in 10 or 20 years after using this device, what will happen, because nobody ever researched this. So we decided to go into the direction that is well researched and that we could take responsibility for.
So it worked, but you couldn't tell it because it wasn't tested.
Yeah, so there was no medical research about the side effect of this therapy. It was the biggest therapy, and a part of like putting the device into the market is going through the safe certification. So because of the lack of the trials, like huge double-blinded trials, we cannot take like responsibility for this device and for the effect of it. That's why we decided to pivot.
Question. So this technology is not made by you per se, or is it like this
Yeah, so basically, we submitted to international patents prior this finding was published. So we also patented the way the bright light therapy could be introduced to the sleep mask. The biggest issue with that is certification and light safety technology, because there's like certain amounts of light intensity that could be delivered to your closed or open eye. So there is a certain way of making it safe and avoiding putting too much intense light into your eye. So yeah, we submitted 2 patents around this. So the range of light is already known for the last 20, 30 years. So it was researched in 70s that blue light affects our organism the most. Like the secret sauce is how to put it into like the source that is very close to your eyes, and what is the frequency of the light, and like how many times per hour we need to provide the light in which stage of sleep. Yes. Okay, thank you very much.